Now let's get to some of your thoughts on our big story from last night. Last night we focused on the federal government's consideration of a foster parent policy similar to what we already have here in Oregon. That policy requires foster parents have to support LGBTQ kids in their care, meaning things like using preferred pronouns and helping provide gender-affirming medical care. We told you all about the local lawsuit challenging Oregon's policy. A Malheur County mom of 5 sued after her foster application was denied after she said she would not support LGBTQ kids due to her Christian beliefs. We guessed that story would have a lot of you emailing us and leaving voicemails, and hello, were we ever right. The majority of folks who got in touch with us support the feds implementing a national policy to put other states in line with Oregon.
I think that foster parents need to accept children as they are and who they see themselves to be. And if they can't do that, they shouldn't be in the business of caring for them. So it appears to me that this needs to be a consideration, not only in Oregon, but throughout the United States. We are who we are, and we need to be treated as we are. And poor foster children have so many things against them. Let's not pit another thing against them. Whatever their needs are, we need to support.
Thank you for that. Manuela wrote to us, if we start providing excuses for this or that differences to be accepted or not in the kids that can be cared for, we're going to put the necessary foster care system on a very slippery slope. People would be allowed to not accept black kids or Native American kids or Jewish kids based on their own prejudices. Not a very American value system.
I do think that that is very important criteria to meet. Regardless of your religious faith should be supportive. And I think that youth who are put in foster homes where they're not supported, then it definitely can be damaging.
Thank you. And as you can likely imagine, we also heard from a good number of folks who think Oregon's policy just goes too far and should not be implemented on a national scale.
My daughter works for DHS, and the stories that I hear from her and her colleagues about trying to place kids, it's incredibly difficult. There aren't enough homes, and to deny this lady in Malheur County is totally 100% discrimination. This is disgusting. Discrimination on a big, huge level.
All right, thanks for your comment. Carolyn wrote in to tell us, I'm sure on the side of the foster care mother who will take care of those children but will not encourage transgenderism. And I'm certainly against this being mandated in every U.S. state. Way too much discrimination against people of faith these days.
Children that have no home deserve to have a mother and a father, and they need to be married. We have got to get back to basics to save the health and welfare of our children.
Amy described herself as a left-leaning feminist atheist and wrote to us to say, if I were a foster parent and had a transgender foster kid, I would beg them to wait until they were 18 or older to make life-changing decisions. I would hate for my foster kid to start gender-affirming care and then change their mind and want to detransition. I guess I would be eliminated from being a foster parent because I do not believe kids can consent to lifelong medicalization. And just like so many of those issues that we talk about right here on our show, there were also plenty of you that find yourselves somewhere kind of in the mushy middle of all this. Karen wrote in to say, first off, I am in favor of foster kids being supported for their orientation. But why can't the state accept a family who disagrees if that is their only fault? Just don't send them an LGBTQ child. We need willing foster families. Children should just be loved and cared for. Thanks to everyone for all your feedback. Hopefully this makes us all think more deeply about this subject. That's why we value your input. We'll continue to follow the federal proposal and let you know what happens.